Good morning. My name is Russell Cook, and I'm the Executive Director of NevadaHealthLink.com. And I have the great pleasure this morning of being joined by Korine Viehweg, who's representing Family Respite Care of Nevada, as well as Reisa Nolte, who's an insurance broker serving the greater Elko area, particularly Spring Creek. And we're going to kick it over to them for just a moment to give some quick introductions. And then I was going to ask some questions about their services and their experience. But before we do that, I wanted to turn it over. We'll start with you, Korine. If you could please give us a quick overview of what Family Respite Care Nevada is all about and the resources that you can provide to residents of Northern Nevada as well as rural Nevadans in general, we'd be very grateful.
Wonderful. Thank you for having me. My name is Korine Viehweg, and I'm the Executive Director for Family Respite Care of Nevada. We were founded as the Northern Nevada Ray Family Foundation in 1995, and our overall goal is to provide a break and improve the well-being of families in Nevada, those that are caring and raising children and young adults with special needs. We opened in the Elko community in November of 2021, and we are operating now out of Reno, Sparks, Carson City, and Elko, and all surrounding counties that families are able to travel into those areas. So if there's families that are looking for resources that aren't in their community, we have opportunities for them if they're able to travel into us. I know there's a family from Lander County that travels to Elko to receive services now. We are serving 66 children and 26 families in Elko currently. And when we started, there were only 3 children that we started with. So it's pretty exciting. We're growing greatly in the Elko and Spring Creek communities, and we hope to continue to grow.
Thank you so much for the introduction. And before I turn over to Reisa, I just wanted to mention we're going to be discussing in a little bit more detail in just a few minutes an event that we have planned to promote awareness of family respite care. It's going to be happening on Friday of next week, correct, in Elko. So if anyone who's watching this video would like to learn more, please stick with us for the next couple of minutes. We're going to provide some detailed information about that event, how you can get registered. We would love to see all of the members in rural Nevada, the northeast part of Nevada, the rural area, come out and join us at that event. And we're very, very excited about being able to make these resources available to that part of the state. So let's go over now to Reisa Nolte, who is an insurance broker who is just about to enter her second year, correct, with Nevada HealthLink. She's also one of our broker grantees, one of our preferred brokers. So we're very excited to have her with us this morning to give us an overview of her role as a health insurance broker, as well as to talk about some of the ways in which she gets involved with the community to reach the uninsured, especially in the Elko community and the surrounding areas. So Reisa, if you could give us a quick introduction, we would be very grateful. Thank you.
Of course. Yeah. Good morning. I'm Reisa Nolte. As he had said, I'm a broker here located in Spring Creek and Elko, Nevada area. One of the ways that I help the rural Nevada area is being able to connect with my community. I grew up here, so I have an idea of my audience, and it's been a really huge blessing to me because I can connect with more members. I can help educate them with health insurance needs. I think the most important thing is to educate them on what type of, or the type of insurance that is offered in our area. Elko is very unique. Rural Nevada is very unique when it comes to health insurance. So being able to educate them and then help them advocate for themselves, in times that they go to offices, being able to understand what insurance they have. And then honestly, just being able to be around in my community. There's a lot of times where I can be in conversation with a client and there's a connection made to where it's like my sister-in-law is like second mom. And so there's really cool moments that I get to have with my clients where just being personable and just being from a small town and being able to just have normal conversation. It's really good because then there's that word of mouth there. And that's truly how I've been able to grow, is just being able to talk with people, attend local events, like at the convention center. They have really awesome opportunity there for the health and fitness fair. And then the home show, we go there as well. and just being able to have those conversations and then kind of getting your word out with being in this area. Since I'm so new, that's kind of been my main focus, is letting members of my community know that I'm here to help them, and there's access, there's someone here.
Well, that is wonderful. And even though you mentioned some of these activities are new, I did just want to clarify, you are a long time or perhaps a lifelong resident of that area. Is that correct?
Yes. Yep. I actually grew up in Spring Creek. I graduated in 2011, and my family moved here in 96. So from 96 to 2011, and then I went to school for a year and a half over in Iowa. And then at that point, my boyfriend at that time, we moved back here and we wanted to get married and start a family. So we've been here ever since.
Okay. No, really appreciate the overview. And I just wanted to put in a little plug here at the near the top. Just over 2/3 of the enrollees who are enrolled in health coverage through the NevadaHealthLink.com marketplace receive free assistance from a broker. And we cannot emphasize enough the importance of the expertise and experience that these brokers can provide. And I just wanted to clarify before we start to jump into a few different questions. For those who may be, in the kind of rural, northeastern Nevada region, but who might not be able to travel to Elko for an actual in-person visit, you can provide assistance over the phone, correct? I mean, if people want to talk to someone local in their community, get their perspective, get their expertise, particularly as different health plans are available in different areas of the state, sounds like that's a great opportunity for them to speak to someone local who knows the community, has those ties, but also has that expertise in terms of what specific options are available in that area.
Yeah, yep. And say I actually do a lot of appointments over the phone. We can do Zoom, so that way we can have a mirrored of the screen to where I can show them what plans are offered. And so, yep, there is that option. Technology it's beautiful.
There really are some great new options in the last couple of years, right? I mean, witness what we're doing here. So this is really fantastic. Well, that was a great overview. Thank you very much, Reisa. Wanted to go back to Korine for a moment. Your organization just opened its brand new location in Elko. Was hoping you might be able to share some more about Family Respite Care Nevada and the role that your organization plays in terms of supporting families, both in the Reno area as well as now in the Elko area.
Yes, absolutely. So we are fortunate enough to be able to share space with Head Start of Northeastern Nevada. They give us an amazing classroom and outdoor space for our kids. So like I said, we provide a break to families who have children with special needs, and we are helping them to just improve their mental health and just physical health by providing families and caregivers that time to rest and recharge. Their kids get to come to us in a safe and fun environment. So in Elko, we're serving children from 3 months through 15 years. And that's children that have the qualifying diagnosis, but also their siblings, so that their parents can take that true and full break. We also provide a volunteer opportunity for high school and junior high students. It's a really cool model that came with the founding of our organization, where we bring local youth in to work hands-on directly with playing and interacting and caregiving to the children in our care. And so they get some life experiences, some real hands-on teamwork experiences. They really learn and embrace compassion and empathy. I think they get to maybe reflect on their own lives and realize that, maybe when a day is tough, that it's not as tough as they think, because they get to see families that sometimes are really struggling. We have children that have autism, Down syndrome, cerebral palsy, children that are in foster and adoptive care, children that might have some mental or behavioral health concerns. And so our spectrum of families and children that we serve is very broad. We do not discriminate for income base or any other, you know, way that other businesses or organizations might not offer that care. It is simply, do you have a child that has a special need? How can we serve you? Because we know that it costs a lot to raise a child with a special need, and families are really struggling, you know, to be able to provide their own care. And so that's really what we're here for. We are currently offering 2 days a week in Elko, Tuesday evenings and Friday mornings, as well as one Saturday a month. Those are 3-hour respite sessions for the family. It is free of charge to the families that we serve, so that we are also helping to reduce the financial stress that caring for a child with special needs families may have. Those families that might be able to afford our services, if they were to pay for them, they have the ability to make a donation. I know our families in the Reno Sparks area, some of them are able to make that financial donation. We are just now starting to raise funds for the Elko programs. So all of that funding has come from a Fund for Healthy Nevada grant. And there was a program modeled after ours in Elko that had to close their doors in 2015. And so we wrote into our state grant to bring back respite to the Elko community and those surrounding communities like Spring Creek. And we're just here to really serve the community. So how can we meet that need? How can we come alongside? We know it takes a village to raise a child, and we really want to be a part of the family's team to make a difference in their life and bring back some joy of just being an individual and not always classified or characterized as a mom or a dad with a child with a special need.
Wow, that is absolutely extraordinary. So not only can parents, fully trust that when they leave their kids in this environment, that they're going to receive extraordinary care from qualified individuals. Not only do the children get an opportunity to perhaps interact with or be around an immersive environment with other individuals who are challenged as well. I was aware of both of those benefits. But I just learned this morning about local youth having the opportunity, the high school children, to come in and not only have an opportunity to serve their community, but I would imagine perhaps also have an opportunity to kind of assess whether or not a career in the health and human services field might be something that interests them. I mean, that's just extraordinary. That's a win-win-win.
It absolutely is. In fact, I often say that our volunteers are the magic behind our programs. So they learn so much, they give us so much, they get back so much. We actually hired one of our very first high school volunteers after she graduated this summer. And so she's on staff right now. And others that we really encourage, if they are looking to work with in the health field, I mean, who knows? Maybe they'll work for you guys one day.
Oh, that's absolutely extraordinary, Korine. Well, thank you very much for that detailed overview. That is some really wonderful work that you're doing out there. We're so glad that you're able to expand your footprint in Nevada and start, expanding your reach and serving additional communities. So really wish you the absolute best of luck with that. I'm going to change gears for a second here. We'll take it back to Reisa. Wanted to ask you, from your perspective, what are some of the unique challenges that rural communities like Elko face when it comes to navigating health insurance options? And, if you want to speak based on your experience in recent years, we'd be very grateful for the perspective.
Yeah, of course. I think the biggest thing is knowing that they have access to that help, Nevada Health Link, as it's a great site. It's actually really user friendly. I think the biggest thing is when you're getting on there, I think a lot of people just feel so overwhelmed with, am I choosing the right insurance? If I'm, with their application, am I putting the right information in? And I think the biggest thing is being able to know that you have access on Nevada Health Link. When you get on there, you have access to look for a broker, and then just being able to advocate and to advocate for yourself and ask for that help and be able to reach out. And I think honestly, in this area that we live in, is understanding on the insurance side of things that what the plans on the exchange offer. I think that's a really big thing, is being able to understand that they're state-based, and then understanding the ins and outs of like the premium tax credits. And they can be intimidating. It definitely is an intimidating subject, like talking with clients, being able to discuss like, hey, like this is where these are state-based, you have an option to be able to receive that subsidy, and then being able to understand what that means, and how that affects your plan and your premium and that sort of thing. But I think the number one thing is just knowing that there are brokers in the area. I'm obviously in Nevada, I'm in a small area and rural, but there are brokers throughout the Nevada Health Link site that are, happy and more than willing to help their clients and community members.
That's a really great reminder about, some of these issues can be complex. Eligibility for these tax credits, the subsidies that you get to lower your monthly premiums. It's not a straightforward topic. And, that's been an issue that we've really been trying to focus our communication efforts on in recent years. We found through, focus groups and interacting with members of the various communities throughout Nevada, a lot of folks are unaware that if you have a family of 4 and your household income is $110,000, you can still qualify for tax subsidies. If you are a single individual making $60,000 a year, you can still qualify for subsidies that will reduce the cost of your monthly premium. But one of the questions we get most often is, people are interested in the bottom line. We can talk about federal poverty level and income as a percentage of federal poverty level. But what they want to know is, how much can I save each month? How good of a deal is this really compared to the individual market, just going straight to an insurance carrier and buying your insurance the traditional way? So, in your opinion, how easy is it, about how much time would it take to answer that basic question of how much can a given household expect to save each month on their insurance? Is that something you can help them out with in a relatively short amount of time?
Oh yeah. Yep. 100%. Yeah. If they have an idea of what they would have a projected income as for the year, I mean, it's really straightforward, but like I said, being able to access the information and understand it. I mean, it's more, I have a lot of clients. I just sat down with one this last week. And he was like, I don't think I even have an option to be able to qualify. And I was like, wait, I'm like, let's get on here and like, make sure that like, the information that we put in is correct, make sure that you're on the same page. And it just was the maybe intimidating part of, okay, why make this much? There's no way. And a big thing is being able to educate my clients in this area. Our networking is very different. We have a couple carriers that are offered on Nevada Health Link that you can sign up for here, and it travels beautifully across the state of Nevada, especially in Reno area if you need a specialist or that sort of thing. But then being able to understand that there are, like, a lot of people are like, well, how does this work compared to employer insurance and the individual? And that's the thing in this area, is that the networking is so different from other areas. Like, if I'm not totally familiar with like Vegas or Reno, but I know in this area there's not the means to be able to have those type of individual networks where you can just go purchase a plan. It's mainly getting on through these type of plans or employers. So that's something too, is just knowing what access you have.
Those are all great reminders. And even though this is a complex system, that's why I want to again really plug broker assistance. I mentioned earlier, fully two-thirds of our enrollees receive broker assistance. And we think that is just of paramount importance. We talked about eligibility for premium reductions. You mentioned an issue which I think is of paramount importance, which is provider networks. Understanding some of the constraints, some of the quirks of provider networks in rural Nevada, being able to look at, even though anybody can look up and see, exactly what that list of the provider network is, we think it's critically important. In our broker community, there's a great deal of expertise, actual boots on the ground knowledge of where these different providers are located at, and you can kind of filter that through your knowledge of, the geography in the area, where a given person might live relative to a certain provider. So I think those are all really good reasons why it's important for Nevadans to seek out assistance from a qualified broker. Wanted to mention also before we go back to Korine, if you go to the enroll.nevadahealthing.com website, and you can just type in nevadahealthing.com in your search engine, it'll take you right there. We have a menu on the top right-hand corner of the screen called Help and Support. And one of the options on the menu is to find local assistance. You can put in your zip code, you can put in a certain radius, and you can find all of our brokers throughout Nevada with their phone number, with their contact information. So if anyone who's watching this right now wants to get in contact with Reisa, and we highly recommend that you take advantage of her expertise, it won't take you but a minute or two to find her contact information and establish that contact and get an appointment scheduled. So just really want to underscore the importance, and it's absolutely free, right? I mean, they can contact you, they can get the consultation, you can walk them through the process. And that doesn't cost them a dime in order to get that assistance. And I think that's why so many Nevadans are taking advantage of that opportunity.
Yes, yeah, of course. And honestly, it's great because I can sit down with a client, and there are times where they don't qualify for a special enrollment, or just something that the plan for them doesn't work out and they need help navigating into a different insurance. And that, like, I've had a lot of clients. I've made connections in Elko at the Medicaid office there, and I was able to I had a great conversation with one of the gals there, and I was like, hey, can I get your card? Because I do have clients who they qualify for Medicaid. And so I'm like, can I, hand them over to you? And you're able to proceed and help that client. So it's something too, where even if it doesn't work out to where they don't get onto a plan, I still help them navigate onto those next steps of, hey, I will call you when open enrollment starts, or, I will help, help you navigate to the next step. So.
Really great reminders. You mentioned, and I just want to touch on these a moment before we move back to Korine, special enrollment periods. What that means is once a year we have an open enrollment period. That's coming right up. It starts on November 1st. That's an opportunity for every Nevadan to enroll in coverage for calendar year 2025. And that runs from November 1st of this year of 2024 through January 15th of 2025. But that's not your only option. If you experience what's known as a qualifying life event, could be, different changes such as, you may have the birth of a new child, you maybe get married, maybe you, gain lawful presence is what they call a change in citizenship eligibility, right? There are all sorts of changes that can occur outside of the year, outside of that open enrollment period, which can allow you to enroll in coverage in Nevada Healthing. So it's another really good area where the expertise in our broker community can help consumers understand their options and take advantage of those opportunities. So really want to thank you again, Reisa, for bringing up all these really great topics. All of these, in my mind, are really good reasons to seek out a consultation from a broker and understand, what your options are, so that you can make sure that you get enrolled in the right coverage for you and your family. Wanted to go back to Korine for a moment. Was wondering if, from your perspective, you could talk a little bit about, some of the unique challenges that rural communities like Elko face when it comes to access to care, like respite care.
Yeah, well, like I mentioned earlier, the respite care that was offered in Elko closed their doors in 2015. And that was a center-based model that was actually taken from our founding model. And they only had one source of funding, and that funding fell through. And unfortunately, during that same time, we lost some of that funding as well. So the state of Nevada was changing some of their ways in their grant cycle, and both of our small organizations got hit for sure. And so again, we worked to recover that funding. It took a few years to make that happen, and then work to get back out into Elko. During that time, from 2015 to 2021, there were no respite services in the Elko community or surrounding communities. In fact, there's no organization like ours across the entire state of Nevada and beyond that we found. We again are in Reno and Sparks, Carson City and Elko. Our main programs are in Reno Sparks. That's our home base. But our biggest growing program right now is our Elko program. We actually have a wait list in the Reno Sparks community of over 100 children. And that is our first wait list since our founding in 1995. It's heart-wrenching to not be able to give the supports that are needed. When a family comes to us, they needed a break yesterday. So to be put on another wait list is devastating for families who are struggling with time, and that's what we do. We provide the gift of time. You might be surprised to know that there are 1,300 children in the Elko community that are on an IEP or 504 plan in the school district. That does not include children that are not in those numbers that are under the age of 3. So that early intervention, that does not include children that are homeschooled, and it does not always include children that are in foster care or adoption care. We recently started to support families with post-adoption because they have indicated that they lose all resources once they adopt a child, and those children still require that special time, care, and attention. And families that are bringing new children into their homes need to be able to take that break. There are 67,000 children across the state of Nevada with a qualifying diagnosis for our programs. And again, that is only through the school districts. And so that does not include all of those other children that I mentioned, those that are under the age of 3, those that are not in school, and those that might not have a formal diagnosis. And so they might not be in that number today, but possibly later. And so the need is large. It's really big. And the community of Elko and surrounding communities and all rural Nevada communities are lacking resources, especially resources that like ours. So there's not even a program like ours in the Las Vegas community. We were modeled in Las Vegas as well. It was called the Spark program. That program has since gone away. We receive calls and emails from time to time about how do we provide services in in Las Vegas. We have interest in Fallon and Fernley and Lovelock and beyond. And so one of our main goals is to be known. We've kind of become, or have been, a best kept secret. And though we can't serve every family, so we can't be overly known immediately, we need to be known that we're making a huge impact on families that need us. We served 663 children in Northern Nevada last year. That equates to 384 families. We had over 300 high school and junior high youth give over 7,000 hours to our programs. The impact is massive and the need is even greater, and we're here for it. So we are so grateful to be partnering with Nevada Health Link to help get the word out, and really to help our families understand what else they have, that you have to offer them with healthcare opportunities. And so I think this partnership is just the start, and I hope that we make a real big splash in Nevada this year.
Wow, that is absolutely extraordinary. And you mentioned a moment ago, helping to get the word out. That is a big part of the reason why we value these community partnerships so much. And I wanted to capitalize on that opportunity to talk about another opportunity for getting the word out, which is our brunch event, which is coming up on Friday of next week, October 11th, right? So I wanted to take just a couple of minutes. I spoke about this in the intro. Want to make sure that we're providing all the details necessary for people who might want to learn more to actually show up and attend this event. So I was wondering if you could start out with just the basics. What is it? Where is it? Who's invited to attend? How can people RSVP? Did already mention that it was on Friday, October 11th, but if you could help provide some of those additional details, we'd sure appreciate it.
Yeah, so I got to visit Elko last week and see the venue. So we're going to be at the Lostra Warehouse, which is incredible. They have been doing some major remodels to this gorgeous venue. We are hoping to have 100 guests, so space is limited and tickets are already on sale. So we definitely want whoever is interested to jump on and get their tickets. You do need a ticket, so you do need to RSVP. It is on Eventbrite. But you can go to our website at frcnevada.org and contact us, and we can send you the link as well. It's also on Facebook. And so as far as I've been told, Elko community loves the Facebook. So that we are out there on Facebook, spreading the word. We're going to be on backstage with Sandy Beeler today. Actually, she's going to be promoting. We're going to have breakfast burritos and other goodies from Kingdom Grub. So if you know, you know. I had a burger last week and it was so delicious. So I can't wait to see what their breakfast burritos taste like. We're going to have Collective Coffee Roasters there. Nuts Under a Buck will be serving mini donuts, which are to die for. And then we're going to have Rua's drinking products that are going to have a mimosa bar and some non-alcoholic drinks available. We are there to talk about our organization, but also spread the good word of Nevada Health Link and how the community can get behind both of our organizations and be able to receive the supports that they need. We are going to all be presenting, and we will have a parent that will talk a little bit about their experience with us. And we also will have a volunteer sharing their experience. So it's going to be amazing.
Wow. And you won't leave hungry.
No.
Right.
You know, we know that, you know, the way through the heart is through the stomach, right? So
I love it. So just to summarize, okay, so frcnevada.com, right? Or is it .org? .com?
.org.
frcnevada.org, and there will be a link to the Eventbrite page, right, where you can purchase your tickets, and you do need to purchase tickets, or they can track you down on Facebook at Family Respite Care Nevada. They can just search for that on Facebook, find your organization's page, and you'll have a similar link out, I imagine, in your feed there. Okay, wonderful. You talked about this a little bit already, but just want to make sure that we're setting the right expectations for what attendees can expect to learn or gain from attending. So if you wouldn't mind just giving us a high-level overview of the agenda. You talked about, some of the information. You talked about one of the speakers. Anything else you wanted to share to maybe entice some of the community members to come out and join us?
Well, we're going to have a raffle. So the Elko community is a very generous community. And so we're going to have a big raffle. And we know everybody loves a good raffle. We are going to talk about the resources that we provide. We can enroll families that day that might be interested. We can get their interest started and get them set up for an enrollment tour. We can, hopefully there's some volunteers that are looking to learn more about our organization, and there's sponsorship opportunities as well. So if there's business owners in the Elko community that want to sponsor our programming, we're going to offer some sponsorship opportunities. Get on the backs of our volunteer and staff shirts, which are our uniforms that we wear, and they get a ton of promotion because our kids love them and they wear them everywhere. And really just, it's really to help us get the word out to families in need, volunteers looking to give back, and business owners that want to make a difference in their community while being recognized. So I think there's lots of opportunity. And then, of course, Nevada Health Link being able to get behind, community members as well, and be able to support the needs of the community in that way.
That sounds wonderful. So truly something for everyone then. If you have a child who has these types of needs, maybe you have those types of needs yourself, could use a little break, great opportunity to learn more about the resources, the information that you would need to get involved with, get affiliated with Family Respite Care. Even if you don't have a family member with those types of needs, but maybe you are in a position to help Family Respite Care, maybe this mission resonates with you, sounds like a great opportunity to come out, meet the folks in your organization, meet the folks in Nevada Health Link. Sounds like you mentioned sponsorship opportunities. That is sounds like a great opportunity for local businesses. We know the Elko community is very generous. We'll encourage anyone in the community to come out, get involved, and understand this fantastic new resource, this great new opportunity in your community. So really appreciate the free.
Hey, I think we forgot to mention that it's free. It's a free event. So who would say no to free breakfast? It will be delicious. It's not, it's free to the participants, not to Nevada Health Link, thanks to your guys' donation and support as the sponsor of this event. But you are bringing this event to the Elko community and inviting them for a free breakfast. So come out, say hi, get to know us. We want to do more.
And just to clarify, I'm really glad you put in that reminder. I might have misspoke a moment ago. The tickets, am I understanding correctly, are just because there's a finite capacity, right? We can only fit a certain amount of people, so you got to reserve a ticket. But there's no cost to the tickets. Is that correct?
Correct. Yeah.
Okay. Just wanted to clarify that. Okay. Wonderful. Well, thank you very much for the overview again. Wanted to switch back to Nevada Health Link for just a moment, kind of in the home stretch here. Because I mentioned earlier that the open enrollment period is going to be starting on November 1st. So that's kind of when the action starts. That's when you can actually enroll in coverage for next year. But there are a number of opportunities available throughout this month of October. In fact, today, as we're filming this, it's October 1st. And this is the first day of what we refer to as our window shopping period. And Reisa was wondering if you might be able to tell us a little bit from your perspective what window shopping is and why it's important and how Nevadans who are interested in enrolling in coverage through NevadaHealthLink.com can take advantage of this opportunity of the window shopping period during October.
Yeah, of course. So the window shopping, you get to get on there onto Nevada Health Link and be able to put your information in. Something that I always tell my clients is you can get on there and you can put, your date of birth, who's looking for coverage or seeking coverage. Your income, is on there that you can fill out, but you don't have to put your email in or your phone number. And you're able to look through those plans. You'll be able to get an idea scrolling through that. Out of these 32 options, we can, find a insurance carrier, Anthem and better, and be able to look on there and see what type of coverage you could have. For the window shopping, I think it's really important to make sure, setting yourself up for the year that, this is the provider that I need. You're able to look in there. I think that it's all very user friendly. There's links right there where it can, provider directory, and you look up onto Anthem site or Ambetter site. But just being able to get on there and take a look, I think it's really important to advocate for yourself and to be able to just get an idea of what type of insurance that you would need for the year, premium wise, like providers, that sort of thing, and just be able to be well-rounded in your knowledge with it. So I think it's a good opportunity for a lot of clients. It's helped me a lot being able to sit with clients, being able to help them. Hey, we can go to the site right now, or on your own time you can. And I've had a lot of good feedback with that. They're like, yeah, it actually was really easy to be able to get on there. It was easy to be able to search through, kind of find the plan information that I would like. And yeah, so it's a really good opportunity. And I do recommend it for all clients, even if you've been on an exchange plan for, a certain amount of years. I still recommend that you get on there and just make sure that you're set up good for the coming 2025 year.
That's a really good point. I'm glad you mentioned that. I was actually going to ask you about that. If you're already enrolled through NevadaHealthLink.com, our system's going to automatically renew you into coverage for the following year. But it's still very much worth a few minutes of your time, in my opinion, to review your options, provided networks change. They can even change in the middle of a plan year, right? So it's a really great opportunity to kind of review, see where you're at, see where you want to be for the next year. Certain providers may have there may be new providers available in the area that weren't in business a year ago. There may have been providers that moved out of your area. So it's a
Yeah.
constantly changing landscape. I don't mean to make it sound like it's overwhelmingly complex, but there can be subtle changes each year that can impact your choices for the following year. So again, really great opportunity, not just for Nevadans who want to get enrolled and gain health coverage, but also a great opportunity to make sure that folks who are already covered are set up well for themselves and their family members for the coming year. Right?
Yep, I agree. Yep, it's a good opportunity, especially, and if you know throughout the year, like right now, no one plans for medical need to happen. No one plans for that, but it's always good to know where you have access to that coverage. Like you said, providers, which ones they have. I have conversation with a client just 2 weeks ago, and she's been on a plan for 3 years, and she was like, I went to an office, and I guess I don't have coverage there. And I was like, okay, well, so we looked up providers together, and I was able to help her navigate through the site. And she was like, oh, I guess I should have done this. And so it was something where, it happens throughout the year, happens to all of us. No one's perfect, but yeah, it's good to make sure that you have access to providers in your area. And then the carriers, each carrier is different with what providers that they contract with. And so it's really important to be able to get on there and make sure that you're on the best plan possible.
Great reminders. And the best plan possible is not one plan, right? I mean, it depends upon what health conditions you might have, how many doctor visits a year you might have, what prescription drugs you might be on, that sort of thing. So again, just really want to emphasize the importance of taking advantage of the expertise that our broker community can provide. And to that end, wanted to ask, as we get kind of in the home stretch here, just wanted to give a reminder. I mentioned before the Find Local Assistance tool on our website, but wanted to kind of ask you from your perspective, how can individuals in your community, what's the best way for them to get in contact with you? Should they go through Nevada Health Inc? Did you have any other avenues through which people can reach you? Now's your opportunity to essentially give a plug for your services, because we're so excited to have you up there serving that community.
Yes, yeah. So easiest, overall, if you are in the Elko area, there are advertising. I received the broker grant awardee, and so I was able to receive that, and I've been able to use those funds to be able to purely market. I've tried to get my name out there, so we've got it's been pretty cool. We've got a billboard in Elko, so that's very exciting. And there's one over by Golconda on the way to Winnemucca area. But yeah, getting onto the site, being able to find the broker assistance, and then just typing in my information. In this area, luckily I've been able to hang a flyer at the local Corey's. It's a family-owned grocery store, and so I've had a lot of people like there at the gym. But yeah, getting the easiest access to it would be on Nevada Health Link site. So, and my information's all on there. And phone number, email, any of that. And I always check my phone, so I always make sure that I'm available to clients and community members.
That is wonderful. Thank you. And I just wanted to acknowledge, how grateful we are that you were able to utilize the money from the preferred broker program in that manner. That's precisely what the goal of that program is. It's supposed to be a mutual benefit to our agent broker community, to Nevada Health Link, but ultimately to the citizens of Nevada, who might not understand that they have options this close to home, free of charge, with this level of expertise. Really too good of an opportunity to pass up, if you ask me. Was hoping we could close out, Reisa. Had one last question, and just asking from your perspective, in your own words, what advice you might have for families or individuals in Elko or the surrounding areas who may feel overwhelmed by health insurance options. How can you help them? We touched on a number of this, these aspects, but just wanted to hear kind of in your own words, your kind of parting words of advice.
Yeah. Well, just know you're not alone. It is as complex as it seems. It is something where it's once those words are used, once you navigate some of the knowledge with it, it is easier to understand. And then it's something where it's not as intimidating. But 100% seek, if you have questions, advocate, speak up, ask for help, be able to go onto the site and, don't just enroll into a plan and, be like, okay, well, hopefully this works. Don't do that. Just make sure that you can get on there, and there is access to brokers, not just me, but brokers throughout the entire state that would love to get on there or love to navigate those insurance plans with you. So that's the biggest thing, is knowing that you're not alone, and asking for help. It's more than okay to reach out and say, hey, I have no idea what this is. And then you're at least having, that normal conversation of learning something new, and then just having someone help navigate you with it.
Well, really appreciate all those reminders. And it is complex. We have an entire staff of individuals here at Nevada Health Inc. whose job is to keep up with these changing regulations, understand the complexity, identify ways that we can hopefully simplify our website, make it a little bit more straightforward. But one thing that I really try and keep in mind is that NevadaHealthLink.com is the only place in Nevada where individuals can qualify for premium reductions. We are the only game in town when it comes to those eligibility for those particular subsidies. And it's not just about lowering the cost of your monthly payment, it's about lowering the cost of doctor visits as well. And there's no other place but NevadaHealthLink.com that can do it. So really would encourage all Nevadans out there, even if you're already insured, to at least make an informed decision about your coverage, maybe your family coverage as well going forward. In just a few short minutes, you can find out if you can qualify for premium reductions through Nevada Health Inc. And even if you don't, we still have the best health plans out there, even if you're not getting those premium reductions. So really would encourage anyone to reach out, get in contact with a broker in your community so that you can better understand your options. I think there's a really good choice that we might have something very attractive through NevadaHealthInc.com, again, even if you don't qualify for those premium reductions. So I want to thank you ladies both for your time so much today. And I wanted to close with one last plug about our Elko event. It's October 11th. Korine, what time in the morning?
9:30 a.m. to 11:30.
All right, great. And it is frcnevada.org. There'll be a link to the Eventbrite. Reserve your ticket. There's no charge, but you do need a ticket for entry, or you can look them up on Facebook. Very much looking forward to seeing you next week on Friday, and I can't thank you enough for your time. Looking forward to speaking to you again soon. Take care.